I am here with Evan Jarschauer, who I am so excited to talk to, and was extremely grateful that when I asked, you said yes and agreed to be on the show. Just to get the attention of some of my listeners who may be like celeb whores. I'm not. I'm a science whore, but and I feel badly for you because you do so much good work, and I'm worried that like on your tombstone will be written, once interviewed Kim Kardashian, and I certainly hope not. But could you just say a little bit about that, because it's I guess it's not going to be your claim to fame, but it is an odd story, I'd imagine.
Right. Well, look, back when I was on the show, at least in my opinion, it was very real. And it was a time where everyone's world was just taking off. And so Kim's. So I was brought in to help with a situation where somebody was involved in compulsive behavior. Help that person through that moment, and to bring the family together to talk through how you can support a loved one who is experiencing some type of mental health issue. So at the time, there was no question in my mind that it was very appropriate, it was real and meaningful. And I think it was also meaningful to the family as well. Whatever happened after I was on and how things exploded, that's cool. But at least when I was there, it was meaningful. I think it was meaningful to the family as well. And, I have to say, and I'll always say that I'm very appreciative to the Kardashian family, as well as Seacrest Productions, that actually helped bring me on to do my thing.
Do you get a lot of shit for that? Like, because I was surprised that the first thing you said was that it was very real. I understand why, obviously, because now we not Kardashians, but like just in general, now we've become more aware as to, how much scripting goes on in unscripted shows. But like, do people give you a hard time with that?
Well, every so often, yeah. But I think what it also does, and how I look at it, and how I would hope a family would look at it, is that if this person is ready, willing, and able to walk into the home of somebody with all kinds of resources and notoriety and help their loved one, and doesn't care if there are cameras on or whatever's going on, that's the person that I want to come and help my loved one. Someone who is willing to do whatever and whenever to help. So you can look at it from one perspective or another, but for me, I think that's been a hallmark of my career, and that's why families and programs will reach out to me to help, is because they know at the end of the day, whether you're in the beautiful waterside town of Hewlett Harbor,
sure,
today, Calabasas, or wherever, that I'll be there with dignity, respect, and understanding, regardless of whatever social strata you may be in. By the way, I've done this a lot, so I can say this.
I know, you're doing great. No, it sounds perfect. Yeah.
But do it in a very dignified, respectful way. But I totally also understand the other perspective of, the concept of, was it some type of commercial something? Was it not real? Was it jumping the shark? That kind of a thing. But in my way I look at it, I would want someone who was ready, willing, and able to go anywhere at any time with anybody to help my loved one.
It's funny. I look at it as this is our job. I'm a psychologist, obviously. Sure. And if someone comes to me for help, they come to me for help. And, I mean, it's similar but different. Like, I have a lot of patients that lost insurance, lost jobs, lost whatever during COVID. And so, you know what? Some people pay me $20 and it doesn't change my care. Like, we go in there with our training, and as you're saying, it doesn't matter who they are, what they are, how much they're paying, what they're, I'm just finding a common ground for me. Like, I still do my job to the best of my ability, and that's what's important. And whatever, in some ways, like whatever that enterprise turned into, to me, I didn't even remotely, I didn't associate it with you, because it was also more than 15 years. I have no idea. I know they're in their like 20th season, and this was like early season.
Yeah,
Because
back in '09, I believe.
yeah, I recognize the intro because like I said I didn't watch an
Right.
episode, but I have watched a few when they started, like before I had children and a husband. But I see I don't know, it's totally different. And I'm sort of almost sad that people doubt you or ask you that, because that's the least interesting of all the good work you do.
Right?
Yes.
Right, now you got it.
Yeah, and so now I just feel like that was your reaction, and now I just feel pissed for you. Tell me who, I'll fight them, because I looked at your resumes. And what you do is amazing. And okay, I haven't said what you do. So so you specialize in a very difficult field of treating people who have been dually diagnosed with a mental illness or mental health issue, and also have an addiction, and not largely substance abuse.
Well, oftentimes the substance abuse is secondary to the mental health issue.
Right.
So I'm mostly dealing with primary mental health cases where people are self-medicating with mood-altering substances like alcohol or drugs or whatever. And so the family has been trying for a very long time to engage, coerce, bribe, get this person some help, and they're hitting a roadblock. They're hitting not only a roadblock with their loved one, but they're also hitting oftentimes a roadblock with the system, the bureaucratic red tape and people's rights and civil rights and law enforcement and judicial jurisdictions. So I'm able to come in. I work within all that, ultimately to maintain an ethical perspective, follow the law, but at the same time, at the end of the day, make sure that the person who's suffering gets the help that they need in the most dignified, respectful way possible. That's pretty much what my job is.
Right, and I shared this with you a little bit, and I've also shared this with my listeners. My mother has spent about as long as I can remember through this revolving door. She definitely, dual diagnosed substance abuse while also some sort of a mental health issue. Unfortunately, she's also some TBI, traumatic brain issues, from a car accident long ago that she never got treated properly for, because she announced that she was a doctor's wife and it was time for her to go. And like signed an AMA and left the hospital because my father.
Your mom's a doctor's wife?
Yeah.
Oh, okay. Let me get myself. There you go. There you go.
Well, that means my dad's a doctor, so there you go.
Oh yeah, right.
Yeah. But so I, he happened to have privileges at the hospital she was brought to after a car accident, and
sure.
He was I like to say she has a golden vagina because he's wrapped around her finger.
Okay.
And they've also been together forever, and so it's a combination of things coming together. And as I shared with you, and I think you will do a better job explaining what this is, but several years ago, push came to shove, and my father and my mother's sister finally decided they had to do something. And Florida has something called the Marshman Act, and which I'm going to ask you to explain because you'll do a much better job. But so my father finally went through with it after years of this being on the table. They go to the hearing, and the psychiatrist at the facility that my mother was at, who did the eval, forgot to sign the paperwork. She was dismissed, sent home. That was it.
Wow.
Yeah. So that was when I gave up hope. But the Marshman Act is a big thing, and Florida is one of the few places. Correct me if I'm wrong, because I know we don't have it in New York. So.
Well, so every state has statutes that pertain, and I'm not a lawyer, right? I don't play one on TV either, but every state has statutes pertaining to involuntary hospitalization for a variety of mental health issues.
Right.
Not every state necessarily has those statutes for substance abuse related issues. And sometimes you have to use the mental health statutes and maneuver them so that they somehow fit if substance abuse seems to be a driving force in why someone's behaving the way that they are. But in terms of having a specific statute specifically for court-ordered residential inpatient substance abuse treatment, you're right. I work all over the country, so as a result, I've learned a lot about each state's stuff. But Florida does happen to have the Marchman Act, which provides for that residential level of care. And if applied properly, correctly, it can provide amazing outcomes. But there's no question, just like with any other court-ordered something, there's so many different ways that you could find a loophole. For example, an order that wasn't signed or something that was missed. And next thing you know, somebody who really needs help, desperately needs help, with just a little bit of legal maneuvering, is looking at the person the petitioner going, what would you do all that for?
Right.
What a waste. Let's go back to New York.
Right. I literally think my parents were in Florida, but I literally think they stopped off on the way home for sushi and she had a drink. Like it was that bad after 3 months of fighting this.
Absolutely.
Right. And the thing about the Marchman Act that's to me unique and wonderful versus, so we have in DC, it's the Irving Act, and every state has a 72-hour hold. Yeah. And if you can sometimes manipulate if the person expresses some suicidality, or if you can convince the doctors or get them to talk to you, regardless of HIPAA, which is another struggle, that's an option. The problem here is the way it was explained to me several years ago is the Marchman Act is kind of created for the Hewlett Harbor, Boca Raton housewife who has nothing to lose by continuing the addiction, because it's not an issue of keeping a roof over the head or holding a job or whatnot. Not all the time, but in some ways, this is a unique statute that takes the burden / power from the family and puts it onto the court.
Right. Correct.
You sounded very doubtful, which makes me think I said something wrong, and I don't mind being corrected.
No, here's the thing. So look, I have a colleague of mine who probably would be maybe a future guest of yours.
Sure.
An attorney that specializes in this exact science of Marchman Act or even guardianships, conservatorships, and it's really popular now. It's very topical now, especially what's going on with Brittany and her efforts to have the conservatorship terminated. But the thing about it is that the courts are definitely presented with an opportunity to make some judicial decision on whether or not somebody needs court-ordered care or not, and hopefully with the introduction of quality testimony of sound fact-finding by psychiatrists, counselors to help make that decision. However, initially, for just the evaluation part, all you really need fundamentally, and with the asterisk that I'm not an attorney, is the family presenting to the court enough information that the court then says this person does need to be brought in for a minimum of an evaluation to decide whether or not there should be a hearing for treatment. So, but yeah, it's definitely, it has the potential, the Marchman Act has the potential to be an amazing resource if applied correctly, using the law as it stands with proper counsel or proper legal guidance with solid clinical foundations to support whatever the recommendations are.
Sure. I mean, listen, a problem I've had and a problem I've had other guests of my show express when dealing with loved ones in this situation is that, suicide attempts. Normally that's what lands my particular parent in the hospital. But is it a suicide attempt if the person refuses to admit it? And no, sometimes no. Like sometimes you're really dependent on the doctor being savvy enough to understand that they need more information. They can't, they have to follow HIPAA. They're worried about their own litigation,
Absolutely. You got to be real careful. I mean, as a licensed counselor myself, right? So I'm able to actually write a Baker Act order, which is the mental health version, kind of the mental health version of the substance abuse or the Marchman Act. I know in New York you've got the mental health hygiene laws, and various professionals are able to sign those petitions.
Yeah.
There's a few people that can sign that petition. I'm one of those people by statute that is able to sign that petition. Thing about it is that families will report to me that every time they call 911, law enforcement shows up, and it's almost like the Warner Brothers frog. Was it the frog that that could dance and sing? But when the audience showed up, it was like ribbit, ribbit, ribbit. And oftentimes is the case that the family is seeing all these out of control behaviors. I'm going to do this and I'm going to do that, and I'm going to take over this building, and I'm going to become the leader of this nation. This is what's going to happen. And when law enforcement shows up and the fact team or the team that comes out to do the assessment in the field, they're like, guess what? My mom's over medicated. My father has a drinking problem, and yeah, I've had some issues, but other than that, if you want to take them with you, you're welcome to do that. But I'm staying right here, and there's not much you can do about it. That's why a family will reach out to somebody like me to come in and to work with the family, work with the patient, the person, and be able to actually observe and see those behaviors as they're happening, as opposed to hoping that you would take your loved one to the hospital, the clinic, or the law enforcement would show up, and there's nothing there to report. There's nothing to show.
Well, I will say we've had success with the police in my parents move a lot, so now I'm Lighthouse Point. We've had some success with them, and they happen to know my mother by now because it's they do the right thing. They take her, but the Baker Act is short-lived, and my mother also does very well in psych wards because she really likes the attention and being the belle of the ball.
You'll get a lot of attention.
Yeah, and so she loves it. She's like the queen of the land. Like sometimes I think she doesn't want to leave, but she doesn't want to stay. But it's just been a constant struggle for years. I have to say, for one reason or another, she's doing better, although substance abuse hasn't changed. And I think part of that is her confabulations have become less negative and more positive. And for my listeners, confabulations are when, due to a atrophy of certain areas of the brain, people start having gaps in memory, and then they make up memories and truly believe them. It's, is it a lie if you don't know they're lying? And so for a while they were very negative, and I was supposedly doing very awful things to her. But now they're more positive. So
Gotcha.
What can I say? The substance abuse continues. We just haven't had to run screaming with our hair on fire recently. But
that's good.
It is, but that's why I was so interested in your job is so important and so difficult. And I did wonder if, I guess, how you ended up there, and I don't mean to overstep, but if you fell into this because of a family member or loved one, an early experience, I couldn't do that for that exact same reason, but I also know a lot of people that, in that mental health profession that do fall into their specialty for that reason.
Yeah. Well, now you crossed the line, mister. No, I'm messing with you.
I was sort of hesitant there. I was like,
no, I'm messing with you. But yeah, look, I think, fundamentally, or many of us are kind of products of our environment.
Yeah.
We end up sometimes where we're supposed to be because, we've lived a life that kind of drove us or led us to what we do. So with that said, like for me, I'm walking into the homes of, people all over the United States. I even work internationally, but it's always with American families that are abroad, and something's going on and I got to go over there and help out. But so the way I look at it is like this. So the families that I'm coming to meet, they're probably going to need to share with me some very intimate details of their world, right? So with that said, I look at it as if rather than me have to necessarily share my world always, I'm cool with having so much of my world already out there for people to see.
Right.
So that's why, I think it's incumbent upon me to be able to be open and honest and transparent as much as possible with people, because that's what I need from them in order for me to be able to do my job and maneuver around all of the pathological twists and turns that I have to be able to, the gauntlet of issues that I have to be able to circumvent in order to do my job. So with that said, I have no problem talking about the fact.
Yeah, I was going to totally call you on the fact that you just evaded my question, but I
had to come back.
I knew you would.
I'm good at going away, and I'm good at coming back.
I got you.
Kind of like Al Pacino in The Godfather 3. Every time,
Exactly.
I try to get out, they keep pulling me back. Anyway, but with that said, so for me, looking at it in terms of, I'm always working with family. So with me, seeing a family being able to come together that's gone through years of torment and strife and challenges because of a loved one, or even there being a mental illness or addiction within the family fabric, and seeing them be able to come together and kind of being that catalyst in a way for there to be true healing within the family, it's a pretty amazing feeling for me. And so, and part of it has to do with getting back to me, is the fact that my world was, my childhood, my upbringing was so disjointed and covert and very unhealthy in the context of having a strong parental or family foundation. With that said, when I was about 5, this was back in Long Island, and so and by the way, I'm looking this way only because my brain works. If I look that way,
it's how all of our brains work. It's okay.
Right. So when I was about 5, my parents were having some hard times. They weren't getting along, and they were getting divorced. And at that time, a father getting custody of his kids it just wasn't very common.
No, I mean, this was the 70s.
Yeah, I don't want to age myself too much, but yeah, right around the middle 70s, somewhere in there, right?
You look good. We're getting older. Let's just call a spade and put that shit out.
It was around 75. Anyway, the thing about it was that it looked pretty bad for my dad. I think that's the way he was feeling, like he wasn't going to, he was going to have to leave the house. He wasn't going to have much contact with me. And one day he came to me basically and he said, "Evan," and I said, "Yeah, Dad." But it wasn't that deep. It was much lower voice at that point. I could probably, "Yeah, Dad," whatever, however I said it. He says, "You want to go away? You want to go on a trip?" And I'm like, they were fighting all the time. So I'm like,
"Oh yeah,
wherever, ice cream, Vermont, Chile."
Did you have any siblings? And how come you did Chile and Vermont at
No, I'm just throwing it out now.
Oh, okay.
I'm just saying wherever. He could have said Machu Picchu. I would have been, let's do it. Incas, right? It's all cool. So.
I'm sorry. So no siblings?
No siblings, no. So he then says, well, just, okay, then let's go. We're going to go on a trip. We got on a train. And we ended up going to Canada.
Is this difficult? I'm sorry. Am I making I mean, I know you've spoken about this before, but I just don't like pushing.
No, I'm good with it now.
Okay. I like pushing, but I just don't want to make you uncomfortable. Okay.
I'm good with it now. Don't worry.
Okay.
But so he said, you want to get away? You want to go on a trip? I'm like, yeah, wherever, whatever, I don't care. However I can get away from this mess, right? I didn't say that, but that was probably what was going on in my brain.
Yeah.
He says, okay, we're going to go on a trip. So it was his day for custody. And we got in the car. We went to the train station. And the next thing you know, we were in Canada.
I think it takes longer than that, but okay.
Well, it wasn't the next thing, but it was a drive. We had a train ride. Here's the crazy thing, that once we get there, I can't remember the perfect conversation, but it was something along the lines of, and now you're going to be starting school here.
Wow.
Well, wait, there's more. and you're going to be now known as Jan.
Okay, not a bad name, I guess.
Right? Well, Jan being a very common, like Kelly, being a very common, like, male name, but,
right.
you know, at the time, right. Jan Honeywell.
Huh.
And so I'm like,
it has a nice ring to it.
right? Yeah. And he was John Honeywell. Crazy. But wait, it's almost like that the world got even more like one of those, you know, Ginsu knife commercials. So wait,
there's more.
Your schooling will now be in French, because we moved to Montreal, and we were living in which was in the province of Quebec. Mm-hmm. There's a lot of English speakers in Quebec, but in Montreal, in that area, was a very French part. And I went to the school called the Collège Français, which was the French school, French college. But, you know, so
listen, your accent is better than my 12-year-old, so I'm impressed.
Thank you. I went there, and now I'm Jan Honeywell. I'm talking French. In the beginning, it was broken, and then little by little, it got a little bit better.
Well, kids are amazing. I mean, yeah, they're amazing the way they're
speaking. Now, what's interesting, you bring the keeping up with the Kardashian show full circle, was that while I'm there, I'll never forget the Olympics were going on.
So right. Okay.
And who was the hero of the 1976 Olympics?
Bruce Jenner.
Other than Bruce Jenner, right? Crazy. I didn't see him at those Olympics. All I know is that that's where he was, you know, became a superstar, super athlete star, whatever. Anyway, so we're about 2 years into this thing already, and my French is good. And
that's the best thing you could say about the situation, honestly.
I'm almost kind of like feeling like this year. Maybe there was a year, and I'm only like 6 or 7. Well, I left when I was 5. It was around going on 7, probably about 7. And maybe I'm kind of feeling this European thing going on because I'm talking French, you know, the pila pew, you know, that kind of thing. And I'm like,
oui, with the ladies.
Oui, and eating the French food and, you know, whatever. And then he says, we're leaving. You know, I'm like, okay. Au revoir, oui. Right. Au revoir. Anyway, so next thing you know, we're in a big bus. He buys this big bus, a camper bus, and we end up driving from Canada. And we land in Fort Lauderdale, because he had an uncle that was in Fort Lauderdale. And from there, that's where I stayed ever since.
So I totally get it, how it makes sense to like put the family back together. I do have a question though, and I don't know how much you remember or what, but did you ask about mom? I mean, obviously the two of them together you didn't want, but
that's a good question. So in the beginning, remember, there was fighting.
Yeah, totally.
And what I've learned is that it wasn't necessarily that my father was the good guy and my mom was the bad woman. It was probably more so that my father packaged everything in the most comfortable way for me, whereas my mom might have been more demonstrating her anger, demonstrating the frustration. It's possible that my father would have been more plotting to not engage with her, thinking that there would be an alternative or ulterior plan, that I'll just be cool with Evan, so that when I come to him and I say, don't you want to get away from this, or you want to go on a trip, he's going to say, of course.
So you
So I
think it
don't.
was like a plan, I mean, it was obviously a plan. It was an amazing plan, but I mean, you think that in some ways he was shaping, well, two things. One is shaping the situation for a better child, it's a better way to present to a child than the
Right.
anger and frustration. Trust me, I'm the anger and frustration. Actually, my husband and I share it equally, but
No, I feel it.
yeah, but it sounds like he was both doing it to protect you and also to,
Right. A secondary gain.
yeah, well,
Right.
yeah, that sounds evil, but yes, yeah.
Yeah. And look, you could look at it this way. Anybody that would take a child from their mother, it's hard to argue the point that there wasn't an evil part about them. It's unless that parent, unless the mother was an evil person and was emotionally abusive.
And that's what I was gonna say. I don't have that same black or white line.
I just don't recall that ever being the case.
Right.
So I don't know. I don't recall that ever being the case. So in the event that this was just a father who didn't want to deal with his ex-wife's bullshit, or the thought of having to share the child or having to give up the family home, and this was to take the kid and leave, you could say that was a pretty maniacal thing to do to a mother, unless that's a situation where she was being physically, emotionally, or even sexually abusive to a child.
Right, but you don't have any memories of that, and I also know that you do. I mean, I know because I stalked you and spied on you, but like it does sound like you do/did have a good relationship with your father, but we're also allowed to look at it through adult glasses now in terms of what the fuck,
Oh yeah, at the time, I never thought of him being a bad guy at all. I thought he was a phenomenal. I thought he was a great guy. So that creates kind of like a dichotomy of like, was I sleeping? Was he really not as good as I had thought? But
were you gonna go with sleeping with the enemy and then thought it would sound
wrong?
Yeah,
it was a bad example.
Okay, I understand. I'm just checking because it made sense to me too. But
I was gonna go sleeping with the enemy, but I'm just saying that was kind of the idea, but it didn't apply. But
I think it would have occurred. Listen, my daughter, when my husband and I fight, she wants us to get divorced. She's almost 11, smart as fuck. But that's because she wants 2 different houses and 2 different sets of Hanukkah presents.
Okay.
So and she's 11, and it's a joke at this point, but like when we went through a rough patch a few years ago, that was her thought. Yeah. And so I sort of understand that, kids are simple, but I don't know if you remember, but the idea of like suddenly not speaking to mom or hearing from her or
yeah. So in the beginning, I would ask about mom, and then after a while, I stopped asking. I was about 15 or so, and my dad passed away.
I'm sorry to hear that.
Yeah, it happened.
You were in Florida?
I was in Florida, and I was living down here and just lived my life. And then my dad passed away. He had a heart attack. And then I was living with my grandmother. She came to kind of take care of me.
Dad's mom.
And one day, out of the blue, I got a phone call from one of my dad's old friends, who was a musician. And here's the story. So he was a musician, and I was playing saxophone at the time.
Oh, nice.
He said, look, I know it's been hard on you. Why don't I pick you up? We'll go over to the studio and we can jam a little bit. And at that time, I'm like, that's cool. I haven't played the saxophone in a long time, but at that time, I was digging the saxophone. Anyway, so I remember he picked me up from the house, and we're on the way to the studio, and he says, listen, there's something I need to tell you. I said, what's up? His name is Jim. That's as far as you need to know. His name is Jim.
Okay, I'm into it.
And and I said, what's up, Jim? And he goes, listen, I met your mom. I said, okay. And she wants to talk to you. So I've got her number. and she wanted to make sure that you had it. At that point, I said, I appreciate it. Now you can take me back. I felt kind of ambushed in a way.
Yeah,
You know what I'm
I
saying?
think that's because you were totally ambushed, but I understand Jim's,
Yeah. So he took me back, and I would say probably about a week later, I called her. I believe he was in Chicago watching. I think he was on doing a gig in Chicago. He's a musician. He's watching TV one night in a hotel, and he sees my mom on TV in a story about mothers looking for their children who are missing. This was kind of close to the Adam Walsh time. So child find and finding kids that were missing was becoming more and more popular. And he called the number, connected with her. I know where your son is. And so that was the story. And then from then we started to speak, and ultimately I saw her again. And ever since then we've been communicating, and our relationship is growing and continues to grow. And, now we're good with each other, and worked through a lot of difficult times and kind of rebonding.
Yeah. And so, well, I want to ask you if it doesn't matter, actually. I was going to ask you if, like, based on what you know of your mom now in the relationship, if it sheds any more lights on the situation, but I'm going to take that back because I'm not the same person now that I was 12 years ago, and whoever your mom was when you met her, one thing has no bearing. It doesn't give us any new information, I don't think.
Right, exactly. We just kind of took off from where we left off and just grew from there.
I think it's a happy story in that it gives hope for fractured families to come back together.
Exactly. Now, I will say that as a result of all that stuff, there's no question that had a significant impact on my value system, my understanding of family dynamics, and so there's no question that I tried a bunch of different ways and things to try to find my way and cope with all those issues that I was feeling by not having the support, the structure, the normal stuff that everyone would have. And I go into a whole bunch of details about that. But I will say that there's no question in my mind, now bringing it full circle, which took me about 35 minutes or 40 minutes, was that all those experiences combined together, there's no question that it has driven me to be able, or driven me to really embrace the healing power of the family.
Yeah.
And how I find an amazing high, if you will, personal high, professional high, spiritual high, when I see the person that I'm brought in to go get help for ultimately agree to accept help. It may not be the happiest moment, but see them actually entering into a program, the family rallying around that, and for me, that's just it's almost like having an opportunity to see something, feel something that for a long time I was deprived of, and being give that gift to families all over the place.
Sure. I mean, I have a quote that I stole from somewhere. It's yours. No matter what anyone tells you, instead of waiting for the bottom to fall out, raise it as high as you can with a comprehensive, caring, and unified, strategically loving approach. And I really love that quote. It's probably too complex for the average person who hasn't been through some sort of trauma.
Right.
But it's also a really high aim. I mean, personally, like, I'm pretty smart and evolved, and like, I still have my issues that come up, whenever we go through this laundry mat of crap with my mom. And so different traumas, but I think similar, well, it's a trauma, and so similarly, a couple years ago, there were a bunch of suicides, teen suicides in town, and I started working with a lot of suicidal teens. And part of the reason I think I was able to hold that space is because these have been words that I've been using, you know, and talking about and describing. And like, I don't make light of it, but I also know that the best place for someone who has feelings and thoughts to be is not necessarily an ER where like
Right.
super educated, inexperienced, you know, people are,
Yeah,
and you can also walk into an emergency room holding a knife and they might send you home, you know.
absolutely.
So I think it's my ability to sort of sit in the muck and your ability to bring out, sit in, but also bring out that make us good at what we do, you know.
Yeah, I would agree with that.
And I definitely, I mean, you're doing so many wonderful things and you're working for so many places. I don't even know how you find time in the day, you know, and then time for me, which I definitely appreciate. And you have a blog that has some great information on, well, you have the website, behavioralhealth.com. And you have this great article on the Marchman Act. For any listeners in Florida, which we do have, you're all over the news, obviously. You also do therapy, and I found your listing on Psychology Today, just like you're a plebeian like the rest of us. But where else can people find you, learn more about you, get some guidance, you know?
Yeah, sure. So my individual work is really more like private case management.
Sure.
So I don't take on any individual counseling patients. Just want to make sure that's clear. And there's a whole bunch of reasons for that. But really the easiest way would be go to the website, like you said,
Yep.
behavioralhelp.com. That will probably give you a little bit more information on me, some of the services I provide. You're also welcome to call me directly. I have my phone is my 24/7 hotline. So if you want, you're welcome to post that if you choose.
I will post anything you tell me to.
Yeah, that's cool. I think, and an easy way, and by the way, I found this out. You can type in Evan the Interventionist, and my site comes up, which is cool. So that's another way to kind of,
That is very cool.
Simple, kind of a Google thing. But other than that, I think that even if you're not reaching out to connect with me, I think that if you do have a loved one who you've been trying, or the family has been trying very diligently to help them with their mental health issues, their substance abuse issues, their co-occurring issues, and you're hitting a brick wall, the system is letting you down, you forgot to sign something, so next thing you know, they're walking down the street again and they're out of control. I think that you should definitely look at reaching out to a trained professional, intervention specialist like myself. And if it's not me, I would be more than willing to help guide you in the right direction, anywhere in the country or anywhere in the world, to have somebody come and help, because I think it really does make a difference when you're able to bring in a third-party professional to help break through walls that may seem impenetrable. And the best analogy I can give you on the reason why, it's kind of like, I have cases where the mother's a surgeon, the father's a lawyer, and these are really smart people, right? And I mean, they probably did real good on their MCATs and their LSATs and whatever else they did, and they're smart and they got resources. But the problem is, or the challenge is, just like a really, really world-renowned cardiac surgeon, if you're in surgery and the OR doors open up and it's your loved one on that gurney, you might want to find another really good, phenomenally well-trained cardiac surgeon to perform that procedure. Why? Because at the end of the day, you are emotionally connected to the outcome. And so for that reason, it's really hard to make some of those major decisions and know where to do this and how to do that and how to approach and still keep a steady hand. Because you can't keep a steady hand when it's your loved one and you're deep in that chest cavity. So that's why you might want to look at bringing in a professional interventionist to not necessarily say something differently, but perhaps present that same message in a more objective, from a more objective standpoint.
Sure. And a lot of my listeners are mothers, and so although we will all understand that because we're all educated mothers or intelligent people, or we wouldn't listen to the Neurotic Nourishment.
And I love educated mothers.
Yes, exactly. Everyone should. But similarly, I try to go by like the 3 times rule, where please clean up your room. Hunter, did you clean up your room? Hey, did you clean up your room?
Right.
And then I'm gonna scream, and guess when I'm gonna be heard? Screaming. Right. But it's not because it's because it's a different voice. Like sometimes loved ones, people struggle with abuse or abuse more than mental health, but both, you need that different voice. And for me, I don't have multiple personalities, so I just use my louder voice, and it's not my preference, but sometimes you need to hear someone else say the same words that your loved ones have been saying for years.
Absolutely. Yep. Yeah.
And I think that's phenomenal. Evan, thank you so much for meeting with us, and I will put everything that we in the show notes, and hold on for a second.